Thank you everyone for joining us today. My name is Samantha and I'm in the marketing team for Compassionate Cultivation. We're excited to be partnering with the Texas Autism Society and their Brown Bag Learning Series to be talking about cannabis therapy for children with autism. Today with us, we have Dr. Keough, Dr. Boeck, and Elizabeth Cross with the Child Neurology Consultants of Austin. So with that, I'll let you guys take it away.
Hi, everyone. Thanks for joining us. And thanks for those of you who might tune in later to see the recorded version of what we're going to present tonight. I'm going to share my screen to show you some slides that I put together for this presentation. So give me a second. There we go. So we're going to talk tonight about cannabis therapy for autism and start with some of the basics. This is a diagram of two different chemicals, which are the most important medical chemicals in the cannabis plant from what we understand today. There are actually dozens, if not hundreds, of different chemicals that you can extract from the cannabis plants, but the ones that are studied the most for medical use are CBD, which is pictured on the left, and THC, which is pictured on the right. So there's a lot of mumbo jumbo information on this slide, but CBD is the chemical that is not euphoria inducing. So that is not the chemical that makes you high. If you smoke marijuana or use it as a drug for recreational use, the THC is what gives you that euphoric effect. So these two different chemicals complement each other and they work together to do the sorts of things that we want for medical therapy. And I'm going to talk a little bit about what we know and understand so far. There's a lot yet to be known, a lot of things that we will be learning over the next few years and decades. But we are using these treatments now with what we know so far. So this is a map of the United States. This is from somewhere around January of this year, and some of the laws that are included in this map that was generated in January have now gone into effect. And as you can see, almost all of the states in America have some kind of legal jurisdiction that allows the use of medical cannabis therapy in different ways. So in some states, and in particular those states where you can actually use cannabis for recreational purposes, you do not have to have a physician involved in supervising these medical therapies. In the green, both dark green and light green, there are requirements that some degree of physician involvement is necessary. Most of the time, physicians and other providers are just involved in saying that a patient is a candidate for therapy. They are not necessarily guiding treatment. Here in Texas, the requirement for physician involvement is much greater, and it actually requires a physician's prescription. So we're going to talk a little bit more in detail about the Texas Compassionate Use Program. So this state-based program makes it legal for physicians to prescribe low THC medication that focuses on CBD as the main therapy for treatment of different kinds of conditions. Physicians who participate in this program have to register through the state through an online registry program. And then each patient that participates is also registered by their prescribing physician in the Compassionate Use Program. There are 3 licensed organizations in the state of Texas that grow cannabis plants and extract medication here in Texas within their own facilities to be utilized by patients who have to live in Texas and have to have a prescription from a physician to utilize that therapy. And that is kind of the basic setup of the Compassionate Use Program. So the original area where CBD therapy and cannabis was used in the state of Texas was for epilepsy. Initially, that was the only qualifying condition. So when the Compassionate Use Program passed, which was in 2015, you could only have access to this if you had epilepsy, and only if your epilepsy was resistant to treatment with other kinds of standard epilepsy treatments. Okay, so the first 2 years of this program, that was all that we prescribed this for. And this is a slide that looks at my summary of patients that I have personally treated. And this is a summary of 113 patients. I updated this in January of this year, looking at who responded to treatment and who did not. And over half of patients showed an improvement on therapy with CBD that was coming from Compassionate Cultivation, and I was taking care of each of these patients individually. About 20% of patients stopped this therapy. About 16% said that their seizures didn't change, and about 7% actually stopped because their seizures worsened. But the majority of patients did show improvement, and a pretty substantial number, almost a third of them, had a very impressive response of seizures. The super responding group had a greater than 90% reduction, and the 17% group was greater than 50% reduction. And those kinds of numbers are numbers that we see in standard studies of epilepsy. And really where we hold a medication accountable, we want to see that level of response. There was another group of patients who did show improvement in their seizures, but in addition to a less impressive response with seizures, they would often see other kinds of benefits. And the list of reported benefits, this is just from my own patients telling me what they liked about the treatment. Listed on the right side of the slide there, often reporting they were more alert, they were talking more, making developmental gains, not using rescue medicines to stop seizures as much, sleeping better, all kinds of different things. And meanwhile, it was unusual that they were reporting very much in terms of side effects. So this medication is very well tolerated, and that's one of the most compelling reasons that I like to introduce CBD and THC therapy, is because people don't develop a lot of side effects. Definitely can get side effects. The most common thing is sleepiness and somnolence, just wanting to sleep more and having difficulty staying awake when you're trying to stay awake. That's the most common thing I hear about. But in general, that can be managed with just adjusting doses of medication. But sometimes there are some gastrointestinal side effects, nausea, some diarrhea, and those things are also dose dependent. So we hear about that a little bit, but in general, compared to a lot of other medicines, the side effects are pretty mild. So last year, when the Texas legislature met again, they actually updated the law for the compassionate use program. And a few really important things changed. One of the things that changed is that epilepsy was expanded, and now, according to the updated law, you don't actually have to be a drug-resistant patient, meaning that patients who were using other medicines and they were working, but wanted to try CBD and see if they could replace their medicines, patients with well-controlled epilepsy could try CBD if they wanted to. They could qualify for the compassionate use program and get a prescription from a physician. They didn't have to be drug resistant. There were also a series of other conditions, most of them neurological, but not all of them neurological, that are now qualifying conditions for the compassionate use program. So there are other kinds of diagnoses that can make a patient eligible for treatment with cannabis medicine. Autism is top of the list, and that's really what we're going to focus on tonight. In my group of child neurology consultants of Austin, the majority of my partners as physicians are active in the compassionate use program, and many of them are prescribing CBD and THC for kids with autism. We're going to talk a lot about that. And Elizabeth Cross, who's with us tonight, is a nurse practitioner who runs a Cbd Resource Clinic through our group at CNCA to help educate families and kind of facilitate our ability to prescribe this medicine for patients with autism. In addition to that, patients with multiple sclerosis, other kinds of progressive, severe neurologic conditions, some of which are listed there, but there are actually quite a few there are several hundred conditions that were ultimately placed on the list through the Department of Health and Human Services. And then patients with terminal cancer, meaning that they had a form of cancer that was not treatable and they were expected to die from their cancer. Those patients are eligible for CBD. And then there's a condition called spasticity. So spasticity is a neurologic condition. It can be caused by lots of different kinds of problems in the spinal canal. So spine injury, for example, other kinds of degenerative diseases like multiple sclerosis that can affect the spine, and also diseases that can affect the brain, whether that's traumatic injury or infection, that can cause stiffness of the muscles that we call spasticity. We know that CBD and THC, cannabis medicine, can help alleviate spasticity, including muscle spasms and pain and stiffness that gets in the way of movement. So we know that that is a condition that responds well to cannabis therapy, and that is now on the list of approved conditions in the state of Texas. So a few other things changed, most of which has to do with the prescriber side of it. We used to have 2 different physicians involved in certifying that a patient was qualified. We don't have to do that anymore. One patient can do that alone. One provider can do that alone for any given patient. Also, the registered prescriber no longer has to be on a published list as being qualified to prescribe this medicine. So that can be something that's not necessarily advertised if they choose. It used to be that if you registered, it was always on a list that anyone could find. And now they can join the registry without it being a public knowledge. And they also chose to change the definition of the word prescribe. So why did that happen? That happened because, as many of you probably know, the use of cannabis medicine is still actually illegal on a federal level in the United States. THC and actually even CBD, despite the fact that it's not euphoria inducing and doesn't make people high, those medications are still not legal for prescription on a federal level, even though they are legal in the majority of states across the United States. This is not something that is being pursued and prosecuted right now on a federal level, but a lot of physicians were nervous about that. So they changed some of the words in the law to make prescribers and physicians more comfortable with the idea that they could comply with a state law without necessarily being so overt about ignoring the federal restrictions. So those were the changes from the House Bill 3703. One of the other really important things that changed is that in the original compassionate use program, the dispensaries were required to have every single formulation have a maximum concentration of THC at 0.5%, which is 5 milligrams per milliliter of medicine. That part hasn't changed. What has changed is that the original program, the original compassionate use program, required a 20-to-1 ratio. So whereas the THC was 5 milligrams per milliliter, the CBD was required to be 100 milligrams per milliliter if your THC content was 5 milligrams per milliliter. So if the dispensary made a 1 milligram per milliliter concentration, then they could make a 20-to-1 ratio and have it be 20 milligrams per milliliter of CBD. But the dispensaries are making the maximum allowed THC concentration of 5 milligrams per milliliter. So originally, they always made the 20-to-1 required concentration difference. That was 100 milligrams per milliliter. So because of the new conditions that got approved, because we now can prescribe it for palliative care, which means treating pain and treating nausea and treating loss of appetite and severe weight loss in that condition, treating spasticity, all of those kinds of things require that the ratio and the mixture of CBD and THC need to be different. When we're treating epilepsy, we want that high CBD concentration with a low THC concentration. When we're treating other things, we might want the CBD to be lower. The THC can't be higher. The maximum is the same as before. It's still 5 milligrams per milliliter, but the CBD now can be as low as we want for it to be. So Compassionate Cultivation actually had to grow new plants to make this happen, because the breed of plants that they were growing originally, they're all clones, they're all exactly, all made from the same mother plant. And originally they were growing plants that would make something close to that 100 milligram per milliliter concentration of high CBD. They had to grow a new plant that had a better, closer to 1-to-1 mixture. And it took a few months to make that happen, but around about October, they started to come out with what we call balanced formulation. And that's where the THC is still the same concentration, but the CBD content is lower. So they now make a mixture that is a 3-to-1, which is 15 milligrams per milliliter of CBD with 5 per milliliter of THC. And they also make a 1-to-1. So that's 5 milligrams per milliliter of both CBD and THC. And these balanced formulations are useful in the different conditions that we're treating now. So I have some patients who are using a combination of the 20-to-1 with some of the 1-to-1. I have some patients who use the 3-to-1 alone. I actually don't have a lot of patients who use the 1-to-1 by itself because we want to have a little more CBD in the mixture. We want that CBD to counteract some of the things we worry about if we get too high on the THC. But I do utilize different combinations of these new formulations as a result. And it's pretty exciting that we have now an opportunity to vary treatment that way. So I'm going to go through a few studies that have been published that look at the treatment of autism with cannabis medicine. This is a field that is still very young. There are a lot of unanswered questions. Most of the studies that have been done are pretty small. Many of them have been done outside of the United States, and in particular, a lot of them come from Israel because the laws about doing studies on cannabis medicine were open for many, many years in Israel and not so open here in the United States. So we're reliant on a lot of other countries for some of our information. There are other studies underway, and I'm going to talk about some of the studies that are ongoing, but we don't have results from that yet. So we are learning as we go. We are prescribing treatments based on these small studies so far, and we are teaching ourselves while we wait for results of bigger studies, and we will be learning along the way the best way to utilize these treatments. So this is one of the earliest studies. It's actually not very old. This is one of the studies from Israel. It was published in January of 2019. But have been going on for a number of years because it takes a long time to really look at long-term treatment outcomes when you're using medication over, particularly for behavioral purposes, because you have to be watching kids over a long period of time. So this is 53 patients. Almost all of them were in the pediatric age range, but there were some young adults. The median age, so that means half of the patients, were around 11 years of age. So some were younger than 11, 50% were younger than 11, 50% were older than 11. They were treated for an average of about a median of 66 days. So some patients in the study only were treated for 30 days, which is a month. Some of the patients were studied for 588 days. That was the longest period of follow-up. So that is, over a year and a half. So a big range of follow-up there. The main treatment in this study was a 30% solution of a 20-to-1 formulation. Okay, so a 30% solution is a little different from what we use in Compassionate Cultivation. There we have a 10% solution, that's 100 mg per milliliter. So a 30% solution would be 300 milligrams per milliliter. And the THC content then is 20, divide by 20 to get to that, right? So let me see, I can't do that in my head. 60 milligrams per milliliter of THC? No, 6 milligrams per milliliter of THC. I can't do that in my head. I should have thought about that before I started talking about it. It's 3 times what we give, so it's 15. That's the answer. 15 milligrams per milliliter of THC. So to follow up response to that, the parents rated response, and they had a bunch of different symptoms that they looked at. And there was a 3-point scale. Either things were better, improved, they didn't change, or they were worse. So they looked at self-injury and rage attacks, which improved in about 2/3 of patients and got worse in very few patients, less than 10%. They looked at hyperactivity in 38 patients, which improved again in about 2/3, didn't change in just about 1/3, and rarely was reported to be worse. They looked at sleep, which was better in a lot of patients. That was the highest response rate, and worse in a very small group. And then anxiety, which was improved in nearly half and a little bit worse in some patients as well. So some variety in those responses, but pretty encouraging because there was improvement in a lot of different areas. And from a side effect standpoint, some of the parents reported sleepiness, somnolence, as well as some change in appetite, but pretty mild side effects overall. Okay. So this is from a second study, a different study, where they looked at a group of patients for a longer period of time, and there was a variety of different kinds of diagnoses. They screened 200 patients, but then they followed about 190 patients. So you remember the last study just had about 50 patients. This is almost 4 times as many patients for long-term follow-up. And most of them made it through the follow-up period for 1 month. A slightly smaller group, but well more than half of the group, 155 patients, were followed for a minimum of 6 months. And a small number of patients did stop treatment during that 6-month period, but the majority of patients continued treatment through a 6-month period. Okay. This is a graph that looks at what dose was given. And the dose on the top is the CBD amount per day, ranging from 15 milligrams a day up to as high as 285 milligrams of CBD per day. You can see that the majority of patients here were in this middle range, which is between 45 and 75 milligrams of CBD per day. I added my own numbers across the bottom of the screen here. That's the milligrams of THC that they were getting per day based on the ratio of a 20-to-1 mixture. And a small number of patients, 44 all in all, so about a quarter of the patients, if they had really severe insomnia, they were actually given an additional dose of higher concentration CBD at night to help them sleep because, higher concentration THC at night to help them sleep because we know that THC in particular is especially good for sleep. So they were taking that 20-to-1 mixture during the day. They were using wherever they fell in this graph during the day, but at night they were getting a little bit of this extra 3% THC to help with sleep. So a mixture of balanced formulation along with high CBD concentration formulation, which I talked about a little bit earlier, that sometimes we mix and match to get a different ratio of treatment. So I like this graph because it's visual. I think it's helpful to look at. And the only way that I could get it to come out color-wise, it has orange as the left where the symptoms disappeared, meaning that they improved. I think that should be green because green would be good, but they used red for that. So red was the symptoms disappeared. That was, ideal response. And then the yellow was improvement, but not complete disappearance of symptoms. And then the green were patients where they said it didn't change very much. So where they saw the best results were restlessness, rage attacks, here restlessness, rage attacks, agitation, and then at the bottom, anxiety. You notice here that there were 2 categories that they looked at, speech impairment and cognitive impairment. Now, if we were able to design a medicine that really helped kids with autism, we would really like to help their speech and we would really like to help their cognition, their learning capabilities. And there really aren't medicines out there that tend to address those primary symptoms very well. And we did have some reports from some of the families of improvement here, but notice that there weren't any reports of disappearance of these issues, right? And there were a lot of patients who did not show much change in those categories. So we know that this cannabis therapy for autism has much more of an impact in these associated symptoms. These symptoms are kind of the heart of what autism is. These are things that we would really like to help. But these are also things that change slowly over a very long period of time. And we tend to target them with things like long-term therapy, ABA, physical therapy, speech therapy, those kinds of techniques. And these tend not to be as responsive to medication therapy. But we can have an impact on things that can cause a lot of trouble day to day. Difficulty sleeping, agitation, rage attacks, restlessness, anxiety. So a lot of reports of improvement in those areas. There's a lot of numbers on this page. So I highlighted and circled a few of the important things. And this is looking at sleep, concentration, and then down here, how did this affect the use of other medications? And just to summarize and not spend too much time on the nitty-gritty details, the improvement in sleep was statistically significant. So they did some analysis of this to make sure that this was a real finding. And the impact on concentration was also statistically significant. And then down here, this is a goal that a lot of families share with me when we talk about what should we try to do medicine-wise. A lot of families would really like to find a medicine that would allow them to stop other medicines that are causing side effects that they don't like. And they did have patients that were able to discontinue some of their other medications or decrease the dose of other medications when their CBD and cannabis medicine was helping them address some of these symptoms. So another way, this is all from the same study, some of the improvements that we've seen. So how do these two different medicines impact different symptoms? We know that CBD has an impact on anxiety. Anxiety has mixed results for THC. High concentration of THC sometimes can provoke anxiety. Sometimes a balanced formulation can be better tolerated, and this is one of the main reasons why a 3-to-1 ratio or a higher component of CBD may be important if anxiety is a big part of the problem. We mentioned before that insomnia, whoops, I didn't mean for that to go forward, sorry. I mentioned before that insomnia is something that in particular responds better to THC, and actually CBD can aggravate insomnia in some patients. Aggression tends to be more responsive to THC and not as much from CBD. We worry about these kinds of side effects here, and I mark them in red just to highlight concerns about THC exposure. One of the things that we really need to learn a lot more about is whether or not high levels of THC therapy, especially over a long period of time, what are the downsides of that? What are the impacts on children if you're using THC as a treatment? We don't have enough information about this, and it's really important that families understand how little information we have, that we need to be watching closely for impact on memory. We need to be aware of the fact that there may be a risk of psychosis, especially with high dose exposure. And that means we need to be respectful of the fact that there could be too much of a good thing. THC might improve aggression, but if it causes psychosis, that might not be a good trait. So I talk about the limitation of what we understand about the downsides and the potential dangers of THC. I talk about that with every family. I think it's really important that people keep in mind that we are still learning about this medicine. There are lots of other medicines that we prescribe for severe behavioral problems with autism, and those medicines have risk of side effects too. So, some families really are willing to take on some additional risk if the medicine is helpful. So it's a matter of trying to find the best balance between risk and benefit. So this is a summary of a couple of studies that are currently ongoing, and there are many more than these, but these are a few that I found online just to point out some of the studies that are going on. These are studies that have placebo controls, which means that the patients will be separated into two groups and looking at one group of patients who are getting a placebo with no medication in it and looking at a different group of patients that are actually being treated. And this is considered the gold standard of medical research. We really need to have placebo controls because if we're just relying on people to say, oh, that looks better, I think that this really helped, that might not be the most scientific way to really know that a medicine is helping. So placebo-controlled trials are really what we need to do to understand these different conditions better and understand these treatments better. So CBDV, cannabidivarin, is another different chemical that comes from the cannabis plant, and there's a double-blind study going on in New York looking at this. It's been going on for about a year now, and they are targeting 2021 to end that. And then there's also another study that's going on in the UK in looking at adults with autism, and it's also randomized. This is a study that's going on in Israel, 150 patients, and they are also randomized. There is a placebo-controlled group in this study as well, and they're looking at long-term responses in some of the cardinal symptoms. So they're looking at cognitive capabilities, they're looking at social responsiveness and other kinds of behaviors. So we're looking forward to getting a lot of those results over the next few years, and I'm sure there will be many other studies as well. So what do we see with adverse effects of high-dose CBD? We do monitor some lab work. I look at liver enzymes, and that requires blood draws. And this is known to be a potential side effect. Fortunately, it's not very common, and it doesn't cause the liver to misbehave, but we have seen higher liver enzymes in some patients who take high-dose CBD. And depending on the THC content, depending on the patient's susceptibility and other medicines they might be taking, sometimes in addition to sleepiness and gastrointestinal side effects, you might get some insomnia, agitation, mood issues, and sometimes aggression, and especially when the CBD is not countered by THC as part of the treatment. We talked a little bit about this on a previous slide. A lot of studies that look at THC are looking at patients who were drug users in the past, not really looking at supervised medical therapy. So it's hard to know how that applies when you're using this as cannabis treatment with low THC content and it's supervised by a prescriber. We like to think that that means we're doing it better and that the risks are lower, but we just still have a lot of unknowns there. So there's a link to a website at the bottom of this slide that goes into very great detail. It's several 100-page documents about the health effects of cannabis use. So just to kind of illustrate what we're up against, all of these questions that we don't have a lot of answers to. So there are some things that we know and understand. We know that CBD has an impact on seizure control. We know that CBD and THC kind of counteract each other a little bit. But what does THC do for epilepsy? Is it important? That's something we don't know a lot about. What about other medicines a patient might be taking? What about long-term effects of THC therapy? A lot of things that we are still learning about. So what do you do in this position? So as a prescriber myself, as a physician, over the years that I have been working with the Compassionate Cultivation Dispensary and learning more about cannabis medicine, I came to a realization that this promising therapy was really something I wanted my patients to have access to, and I wanted to participate in helping them make good choices about how to bring this into their treatment plan. It is definitely not something I prescribe for everyone. Every single patient that I see has their own decision, has a situation that we have to take all of these factors into consideration and decide when is the right time. Is there a right time for that child to consider cannabis treatment? So it's really a challenging question that I think about individually for every single patient. It's especially compelling, I think, when I have patients who have tried other kinds of treatments, and that's true in epilepsy when the seizures keep coming. It's also true in autism when behaviors continue to be challenging or a patient just won't sleep and everyone is exhausted. There comes a time when cannabis therapy may have something to offer and may have a better side effect profile than things they have tried previously. So it's a long conversation. There's a lot to talk about. I'm not going to go too deeply into dosing and treatment because there's a lot to be said there, but really it's also an individualized process. We start with low doses, we work up gradually over a course of several weeks. Sometimes it takes months to get to the target dose and then continuously readjust depending on how the patient resolves. Okay. I think we are close to the end here, but this is just a summary of how a 20-to-1 formulation compares to a 3-to-1 concentration at the dispensary. And this is just a comment a little bit about over-the-counter CBD. So if you walk into the local drugstore or GNC or even your local Exxon, you can find CBD for sale. Generic CBD is everywhere. About a year and a half ago, the federal government changed some agricultural laws that made it legal to sell CBD from plants that are called hemp. And a hemp plant is a type of cannabis plant, but it has a very, very low concentration of THC, much lower than what is sold through the dispensary. The problem with generic CBD is that there really isn't any regulation in that world, and what is sold does not always have actually what's on the label as what is in the bottle. So I really discourage families from utilizing over-the-counter CBD and internet sales, because I think that the reliability of that product from one bottle to the next and just knowing what your child is taking is questionable. So, so I tend to stay away from those things. So I'm going to stop sharing and go back to our, if I can figure out how to stop sharing. There we go. There we go. Back to our video, and I'm going to give the floor over to Elizabeth Cross, our nurse practitioner, and let her talk to you a little bit about our CBD Resource Clinic at CNCA.
Thanks, Karen. So back in October of 2019, we kind of came together as a group and started talking about this as all the legislature changed and it opened it up to the world outside of epilepsy. And at that time, I said, this is something I'm interested in, and everyone kind of supported me, which was great. So along the journey, I spent basically from October until January developing this new clinic. And it's named Cbd Resource Clinic for a reason. Nurse practitioners cannot prescribe. I am not allowed to be on the CURT registry to be prescribing medical CBD for patients. So my role is really an educational role. And like Karen said, there's a lot of factors that come into play when you're talking about, is this right for my child, or is this right for my family? You know, there are other things we should try first, or is this what we should go to next? And so a lot of my discussion is education, talking about over-the-counter CBD, how that's different from dispensary CBD. I've coined a term, I think everyone who's a patient of mine knows, I call them CBD sold here stores. There's a lot of those. You see the flags all over town. I also stomped the pavement and I went into those stores and I just inquired, you know, what do you sell? What is it? What does it do? What do you think it does, right? And I think what I've learned is that there's so much inconsistency in products that it really made me feel like I needed to explore this even further for my patients, because like you said, you can't trust within that. Unfortunately, I wish it was better. But right now, anything from toxins to higher or lower concentrations of THC or CBD are, you know, probably in those products. So, you know, I actually took a 10-hour CME course about medical marijuana. I watched all the shows and documentaries that everyone can watch on online to be able to find out what all the questions are and what people want to know and what information and misinformation I think is out there. Read these studies that Karen's talked about. Again, Israel seems to be the top player in this game right now. And so in late January of this year, we opened the clinic. I started seeing patients on Wednesdays only. And my clinic has really grown. I would say the majority of patients are autistic patients, although I do have 1 or 2 spasticity patients, and I have many epilepsy patients also. So, you know, I really like to fill that hole of the educational part to families and to alleviate the pressure from the physicians to have to go through all of the, well, what if this? And I looked into this, and there's just so many products out there. It's really hard to know them all. And also, I try to do a good job of tracking all the symptoms. So as you know, this isn't something like with seizures where we can say, man, the seizures went from 20 to 2 this month, right? That's a number that we can track, and that's a real number with like data. This is different. This is very much, oh, I feel like he's behaving better, or I feel like we had less tantrums. And I have a couple parents who are wonderful. They keep logs and they tell me exactly how many tantrums they had and how long they lasted. And they have some really good data for me, which is wonderful. But the things I'm tracking in my clinic are attention instead of hyperactivity. I think they're in the same realm, but I'm trying to stay away from ADHD as that's not something that's covered right now. Anxiety, sleep, and behavior. I've added a communication component as well. Like Karen said, it's something we would love to see change, and we have seen in a few patients their communication improve, but that's not something that we always see. But I always want to be able to track that, because that's It's not quite as good as seizures 20 to 2 in 1 month, but it is something that we get to look at and say, man, their vocabulary expanded, or they're putting 3 words together, which they've never done before this month. And that's a big deal. So I do track those. And I really just feel like this has been a great clinic to get up and running. And I want to be able to help as many patients as we can. I think the most important thing about the clinic is I do not replace your normal neurologist. You will still see your normal neurologist as you always do. My role is really just to monitor and give recommendations to the neurologist about CBD. And because I get to see most of you who are on it, then it does give me a really good tracking parameter to be able to suggest, oh, you know what? I had one family we did this with and it was hugely successful. We could try that, right? And so then I propose it to one of the physicians, and then they, decide if that's the route they want to take with each patient. So you'll still be seeing your normal neurologist. All other meds will mostly be taken care of by them. If there's something that we're weaning and titrating at the same time, I do get involved and we try to work together as a team and make it all happen. But it's been a really great clinic. So I appreciate everyone's support in the process, and it's been good.
I'm going to introduce Dr. Boeck briefly. He's one of my colleagues at CNCA. We have 11 child neurologists in our group. Almost all of them are on the registry. Dr. Boeck, one of his main areas of focus is managing patients with autism, establishing that diagnosis and treating patients with autism. So I asked him to participate today as an autism expert to talk a little bit about how this has fit into his clinic to treat patients with autism.
Hello. So I guess I'll start off by saying that this is kind of a moving target for me. How I viewed this back in the fall when we kind of first got the indication for autism has even shifted just in kind of watching it with my own patient population over time. Initially, I was kind of waiting for people to show interest to me with a little bit of caution, kind of jumping in on it, especially with not a lot in terms of randomized control trials and still lacking the long-term safety data. Overall, I have had fairly positive responses, and that has definitely started to shift my perception of how much I should be recommending it versus kind of waiting for other people to say, this is something that I want to do. And I have definitely started to look for the patients that have not just a diagnosis of autism, but some of these coexisting issues that it really does seem to be more effective with regards to CBD showing clear improvements in some of the preliminary trials. So I have definitely started using it a lot for the kids with a lot of aggressive behaviors, especially the same ones for which I would be considering Abilify or Risperdal or one of the medications that does have more intensive side effects. Because you really do have to kind of weigh the risk. We have a medication that we don't know the long-term side effects versus one where we do, and they're actually pretty significant. And so lack of knowledge is not necessarily meaning that it's worse than something we have knowledge on in some cases. And I think especially with some of the meds we have to get to for more severe aggression, that can be an important distinction and one that makes CBD a very valid option. Obviously, I'd love to be 20 years in the future and kind of know, like, okay, what happens with all these kids that have been on it over time. But when your child has autism now and is trying to get through their therapies and progress forward through schooling, you can't wait that 20 years to find out. So we have to kind of do the best we can with the knowledge that we have. And I have had plenty of kids that have been on multiple different medications and really not seen good benefit, and have seen that benefit come with the CBD oil. It's been enough to definitely convince me that, okay, I don't think this is placebo effect. Even though we don't have those great placebo controlled trials, I have patients for whom I have really, said, okay, this is kind of the gold standard. This is what we use for this, and it didn't work. And then we tried CBD, which in many cases don't play up as much as some of these other meds just because we don't know as much about it. And yet sometimes that does tend to be the effective option. I've definitely had some families for whom it doesn't seem to do anything as well. So I'm not saying that it is perfect by any means, but I think it is definitely a very nice tool to have in the arsenal. I am really interested on studies looking at, over time, what is the optimal dose and what is the optimal THC concentration. And I think it's going to take a long time to get that sorted out because each of the studies seems to be focused on a different attribute and sometimes even a different component. But it's something that I'm definitely interested in kind of exploring further with my families. And I've also sent several to Liz Cross as well to kind of assist in that management because she's definitely gathered a lot of information on it.
So I'm gonna ask Sam to come back in and share some questions with us and see what else we can tell you guys.
Hey guys, no, that was great. Thank you, Dr. Keough. Thank you, Liz. Thank you, Dr. Boeck. Liz, great job. One of the first questions I was going to point out was one of our attendees talked about how Liz is collecting some great data, and he asked if she was going to publish her findings. So, and that is.
I hope to. If anyone's not reading the chat, I said that's my ultimate goal. I would love to do that. It would be,
It is great. It's great on what you're doing. One of the questions that we got is there any research that you guys have come across on using CBD to treat OCD?
I think my answer is because it hasn't been approved in Texas, it isn't something I really dug into. Karen?
I don't recall seeing a study that broke out OCD as a particular target symptom on outcome. I have not seen that. That doesn't mean it doesn't exist, but I have not seen that yet.
Yeah. So to the person that asked, we haven't seen anything. She was asked specifically as a side OCD in kids with autism, of course. So yeah, we'll be looking. That's just definitely some data that Liz would be collecting, of course. Someone was referencing, Dr. Keough, your study, and I think they said on one page of your metrics you showed less than 50% improvement for anxiety, and on another page it showed about 90. Can you speak to the differentiation and those two numbers?
I was trying to look, Karen, while you were speaking to be able to say something about that. I can tell you the slide numbers.
Okay.
I think.
I can bring it up and share it too.
So it's the 30% study, so the observational study for autism. On that page where you have observational study for autism, it shows in there under results, anxiety N of 17 improved in 47.1%.
Which slide is it?
I don't have numbers on my phone, unfortunately. I mean, I can count it out. It's just past your own big pie. It's 2 past your own big pie, or 3.
Oh, okay. Yeah.
Does that help?
Share this again.
Yeah.
Okay. So this is from the observational study, anxiety. Only 17 patients answered the question of anxiety, and 47% of those 17 patients, so that would probably be 7 patients or 8 patients, reported improvement, and there was worsening in 25%. So probably that's compared to this graph, where there was a much higher reported percentage improvement. So this graph comes from a different study. This graph comes from, let's see if I don't know that I have the reference.
Oh, I was trying to look to see if the reference was on there.
Yeah,
I'm sure
I don't think I have the article that this graph comes from, but this is not the same group of patients. So the first slide with this 47% improvement was the study of 53 patients. The second graph with the much higher response rate regarding anxiety is from this second group, the prospective observational trial, where they started with 200 patients and then they included 188 patients, and they looked at long-term outcome. And this 80% or almost 90% improvement of reported anxiety improvement, that came from that trial. So that's why there are 2 different numbers. There were lots more patients. Now, remember that this was, a choice of improved versus no change versus worse. So it was a very rough measure of response to treatment, it was not something that was necessarily a big difference. And I'm just realizing, I don't know, could you guys see my charts?
You weren't sharing them at the time, but
okay. Well, here it is. This was the one with a very high response rate, close to 90%, came from this trial here of close to 200 patients. The previous one with the low number of response rate, the 47%, was from a different study with 53 patients. And that's why the numbers are different, 2 different studies.
Great. Thank you for answering that. One of our attendees asked, if given a prescription for this by CMTA, where is it filled? Is it physically from Compassionate Cultivation in Manchester?
I'm happy to.
I guess I can answer that one.
Yeah, I can take it too. I can be the third party, because it's obviously you guys are Compassionate Cultivation. So there are 3 legal dispensaries in the state of Texas. There are 2 that are currently operational and selling products, to my knowledge, the last time I looked into it, which was a couple months ago. One of those only offers a 20-to-1 formulation, and then Compassionate Cultivation offers many more variations in products. And so the answer is, if you're getting a 20-to-1, you can go to Certera or you can go to Compassionate Cultivation. And if you're getting a 3-to-1 currently in Texas, Compassionate Cultivation in Manchaca. And yes, you have to go there, or they have a delivery service, but that costs extra.
Yeah, that's exactly it. We deliver all over Texas. So
yeah,
you essentially, after your neurologist or your physician has said they're putting in a prescription, the way that it works is you would actually call the dispensary. The dispensary confirms you have a prescription in the compassionate use system, and then we can go ahead and fill it.
I think the thing that patients are most concerned with is that physical prescription. And I think that the misconception is there's a prescription somewhere that we have to fax. And it's the way this works is, like you said, it's in the system. And so there is a Texas system that all the providers are able to put that information into. So regardless of which dispensary you choose, they all have access to that prescription. So you call the one of your choice and you get it filled.
Yes. And the misconception on our end is that we automatically know. We actually do not know that you have a prescription unless you let us know.
Right.
So
we don't send it to you. It's up to the patients to decide that you are where they're filling it.
Yeah, and the system's a little bit clunky, to be generous. It's more than a little bit clunky. And if the identifying information is off by 1 digit, or the patient's name has an extra E in it or something like that, the dispensary can't see it. So we've been through that a number of times too. So sometimes there's a little back and forth to get those ironed out, but it does work well, and it's very much privacy protected, so no one else has access to that. The dispensary can only see it if you call them and ask them to fill the prescription.
Yeah. So a really good question we got is, how do you determine if a child with autism needs CBD?
I'm going to let Dr. Boeck answer that.
I'm not yet at a point where I feel like autism by itself is just an automatic, okay, you should be on CBD. You know, I think if we ever do get studies that say, okay, it improves language, it improves social skills, and any of these things that are just like everyone with autism has an issue with it, then I'm going to change my mind on that. But in the meantime, I am using it for kids that, on top of having autism, have some of the issues that we know it can be beneficial for. Insomnia, self-directed aggression or aggression towards others, sleep issues. And I'm especially interested in the people that have already done the more conventional medications and it either did not work well for them or they had side effects from it that were not really well tolerated. And so we're looking for other options. And I think those are the best candidates. I'm starting to get to the point where I feel like, you know, there are some kids that have such a collection of these issues that we've all seen potential benefit of, that even without having done medications in each of those areas, they might be a good candidate. The kid that has a lot of anxiety and insomnia and self-directed aggression may be a really good candidate for CBD because it may help with more than one issue at once, whereas otherwise you might end up with 2 or 3 meds to accomplish those goals. So those are typically the kids that I'm looking to start it for. The child who's actually doing well with their therapies and they're sleeping well and they're not overly anxious, but they're just struggling with language and social skills at this point is not someone that, for me would be a great candidate.
Great, thank you, Dr. Boeck. Somebody asked how do they know if their current neurologist at CNCA is on the registry?
So I'm pretty sure that everybody that's on the registry has their name published on the registry. I can tell you, just going through the list, that Dr. Boeck is on, I am on, I only do epilepsy. So some of my patients also have autism, but I'm seeing patients with epilepsy as my main focus. Dr. Reardon is on the registry, Dr. Karnick, Dr. Godsey, Dr. Elton, and Dr. Kerr, right?
And Jeff Kane.
And Dr. Kane. So almost everyone.
Almost everyone.
Oh, and Dr. Aaron Carden is on the registry too, also an epilepsy specialist. So there are only a couple people in our practice who are not. Within our group, and we have pretty much an agreement, we collaborate a lot. So if one of my patients who is not on the registry is interested in helping a family get access to cannabis, we share, and we will send patients through Liz and help you find another provider who can help get that prescription started.
Yeah. Another question that we have is, I have a child who is often resistant to taking medications. Have parents expressed difficulty with the administration of these meds? Dr. Keough, you look like you might know the answer to that.
It can be hard. So Compassionate Cultivation has a couple different flavors, which helps. They have unflavored, which is good for kids who hate flavors. They have mint and they have cherry. They have a spray form, but the spray is only the high concentration form right now. I would love to have a spray form of the balanced formulation. We don't have that yet. But they've been very proactive about trying to get different formulations that will be acceptable to lots of other patients. The spray is a nice alternative in some ways, but the oil can be mixed with other things. It can be administered through a G-tube, especially if you mix it with a little bit of formula. So a feeding tube can be used to administer medication. But it can be challenging, especially when the dose gets bigger. I would say I don't have a lot of patients who refuse it. Most people can get it in. It's just a matter of kind of getting into that routine. But it's a common problem in the world of pediatrics to get a child to be cooperative with medicine every single day.
And I think compared to an antibiotic, which you're talking 5 to 15 mLs of fluid, we're not talking about that much. The physical quantity is less. So it's not typically that big of a deal. And as long as you can get them to keep it in their mouth, then you've won, because that's all we need. The swallowing it right away doesn't matter. So
I've seen less resistance to CBD than a lot of the other meds that I use.
I agree.
Yeah, for some not so great tasting antibiotics. So someone asked, does medical insurance cover this medication and the appointments associated with this? So I think this is a great two-part question, obviously, because the answer is different for both. So yeah, you guys go ahead.
It is not covered by insurance in any way, shape, or form currently.
The medication is not.
The medication is not, but the appointments are.
So cost is definitely a challenging issue. Patients often ask me, is that likely to change? I wish I could tell you otherwise. I don't anticipate that will be changing in the near future. Insurance companies get to make the rules about what they pay for and what they don't pay for, which is an interesting arrangement, but that's the reality of it. So they generally would not be interested. They view this as a supplement. It's not an FDA approved medication. It's not something that's likely to become approved as treatment. The advantage we have in treating children is that some children are quite small, and a small child doesn't need very much medication, and that makes it more affordable. The balanced formulations, the 3-to-1 and 1-to-1 formulations, are considerably less expensive than the 20-to-1 because there's just less medication in the bottle. So the patients will often ask me, what's the cost? The cost can range anywhere from $50 or $100 a month if the dose is very low, up to several $100s per month if the dose is high enough to get you to a milliliter a day or 2 milliliters a day. It's not unusual for it to cost that much. In the world of high deductible insurance plan, paying out of pocket for medications has become more and more common. A lot of my patients with epilepsy will spend a couple $100s a month on their epilepsy medication. So I have some patients where this is less expensive than some of the medicines that they buy that are supposedly covered by insurance, because what insurance companies will contribute to is a lot more money, and their portion of it might be $100 or a couple $100s a month. But yeah, cost is challenging. The appointments are covered.
Great. When trialing a high quality CBD, how long should someone give their child a specific dose before they can start increasing?
Take it, Karen.
Lots of answers to that. Yeah. So it is a very long-acting medicine in the sense that it takes a long time to metabolize, and when medicines are metabolized slowly, it takes a long time to adjust to new doses. So when I make a dose adjustment, I expect that it will take several days, perhaps a week or longer, to see the impact of any dose change. I am a huge proponent of slow adjustment of this medication because I want to make sure that we're not giving too much. I want to make sure that we're seeing the benefit as we go higher, especially because of the cost issues. And because if you go more gradually, the payoff in the long run is that you can get to much higher doses. So if you try and push up to a high dose really quickly, you'll end up with a lot of side effects and patients won't be able to tolerate it. And you give up on a medicine that might have been very effective if you had been more patient with the introduction. That's true of a lot of medicines, but I think it's especially true of CBD. So my usual approach is to take 4 to 6 or even 8 weeks to get to the initial plateau of where I want to get with medication. That is a little easier to do when you're targeting, symptoms like anxiety and sleep and things like that, versus a child who's having really active seizures and you want to get ahead of those seizures. There's a lot more need to really push that a little bit faster. So when we have the luxury of time, I think going slowly and giving weeks between dose adjustments is important.
Great. Do you guys treat all spectrums of autism, specifically severe and nonverbal autism patients?
We all nod. Right?
Yeah. Everything.
Yes, we all see that.
And the severe end of the spectrum is not as common. Mild autism in the way that it is defined and diagnosed today, Dr. Boeck could speak much better to this than I could, but there are lots and lots and lots of children who meet criteria for an autism diagnosis today who wouldn't have 10 or 20 years ago. So mild autism is very, very common, but probably not a group of kids who would be needing medication therapy quite so much.
Okay.
Dr. Boeck, agree?
Yes, absolutely.
When patients come to you, do you ever get questions about strains? So we had one question from a patient that was stating that they've seen some products that are sativa based that make their 9-year-old super hyper. Do you guys discuss strain specific information with your patients or caregivers?
Not particularly. I wouldn't say that I know all the strains from what Compassionate Cultivation has versus what Sutera has. So it'd be hard for me to speak on that. If they had a question such as that, I would have to go to you guys directly. Karen, Dr. Keough, anything?
Yes, I'll field that a little bit. So I serve as the medical director for Compassionate Cultivation. So when the dispensary first opened up and we were making plans on how we were going to design the medication and create medication from the plants that were being grown, as I said, there's one population of clones that grows and makes the 20-to-1 population. They bred their own strain of cannabis plants. But what is produced at Compassionate Cultivation is a pure extract. So to some degree, actually to a very great degree, it is kind of strain independent, because what is being brought out is the chemicals of THC and CBD, and the other chemicals from that cannabis plant are not in the product. Now, there's a lot of discussion, still ongoing discussion at the dispensary as to whether we should include other chemicals from the cannabis plant in the products that we sell. So there is actually a plus formulation that is made at the dispensary at Compassionate Cultivation. The plus formulation has other kinds of chemicals mixed in that are called terpenes. Terpenes are what give cannabis products their fragrance. And even as a pure extract, it has a compelling fragrance, but it doesn't have, the terpenes are specifically not included, but it is chemically possible to add terpenes back into the mixture, and that's what they do when they make plus mixtures. And you can purchase a product with terpenes mixed in. What you cannot purchase at this point in time at Compassionate Cultivation is what's called a whole plant extract. So a whole plant extract has a specific kind of concentration of CBD, a specific concentration of THC. It has the terpenes that are the mixture from whatever mixture of cannabis plants went into the machine that we pulled the chemicals out of. And it also has other kinds of cannabinoids. So remember, one of the slides talked about CBDV. There's also a chemical called THCA. There are dozens of different cannabinoid compounds that come from the cannabis plant. A whole plant extract will have all of those different kinds of chemicals, and that is very much strain dependent. But the way that medicine is made at Compassionate Cultivation, what strain the medicine came from is not as relevant. When you get CBD over the counter, which comes from a hemp plant, there will be other chemicals in it. It will be strain dependent, but when you're getting a hemp product, it has enormous numbers of plant that are required to give you enough chemical, and that's one of the downsides of generic formulations. So it's mixing up a whole bunch of different kinds of strains. If you're getting medication that actually comes from a cannabis plant, which you can't get in Texas because that's not hemp-based, but if you went to Colorado or California and went to a dispensary in one of the states where it's legal to do so, where there are lots of different mixtures, those would be very much strain-specific kinds of formulations. But what is sold in Texas, the strain is not really playing much into how we're doing treatment right now. That's kind of a long answer to that question.
Oh, it's a great question. We get asked it a lot, actually.
And I guess the other thing I would add is that we talked about the limitation of studies and research that help us understand what we know about CBD and THC. What we know about strains is even less. There are no look at sativa versus terpenes or not terpenes. We don't know what those variables introduce into treatment. And that's why when we were first talking about how to make this, I wanted those variables off the table. I wanted the treatment to be pure extract so that the only thing that I was prescribing was CBD and THC, so that I could keep that as level and consistent as possible at the start of things. Now, down the road, I think there will come a time when we do have whole plant extract through Compassionate Cultivation. And, hopefully by then we'll have more insight into those questions.
Yeah, that's great. Last question before we kind of sign off is, do you have any suggestions or websites that would be helpful when talking about medical cannabis resources or programs?
That's for you, Liz.
Is it? I think the hardest part is it's really, really hard to find something that has good data, not just facts. Facts aren't true unless there's data that supports it. So any one true site, I don't know that I could speak to one. I think the best thing is like Dr. Keough presented, is there are numerous studies. Again, most of them are from Israel. Um, you know, there's a lot of pop words out there, just like what Dr. Keough was talking about with whole plant, you know, whole plant, full spectrum, entourage effect. These are all big words right now that are floating around that say, oh, this is so much better. And oh, it says I should only use full spectrum or whole plant. And I think, you know, I go over this a lot with my patients. You know, there might be a time for that, but I think what I love about Compassionate Cultivation's product is that because it is pure, you're taking out all of those other things you could have allergies to or side effects to, and you're really focusing in. But as far as studies or a website that you can go to that has really solid information, it is hard. I think that's what I found the most compelling during this.
So I would recommend the Compassionate Cultivation website. I honestly, I
agree with that.
Because they have put together a huge collection of resources, and it is aimed towards patients and families, and it is also aimed towards prescribers. And I think it's one of the best collection of websites and articles and publications, and it's been compiled with careful attention to trying to make sure that it is data-based and to the greatest degree that we can make it be within the limitations of what we have available to us with all of the unknowns acknowledged. It's a nice kind of filtered way to get access to good information.
Yeah, that's great. Thank you guys so much. Again, last question. This may be directed towards you. How can someone go about making an appointment for your Wednesday clinics?
Yeah, so as long as you are already
You're really soft. Speak.
Oh, am I?
Yeah, I don't know what happened.
As long as you're a patient at CNCA, you just need to talk to your current neurologist and say, look, I'm interested in CBD. As long as they feel like you would also be a good candidate, then they can recommend you for my clinic, and the schedules will get you scheduled. I have some patients who the provider says, look, they just want more information. You know, we're not there yet. We're not sure this is really what we want to pursue, but they really have a lot of questions and I don't have the answers. And so we just set up a time for a new patient slot, and I just give, you know, as much information as I can and answer as many questions as I can during that appointment. But it doesn't mean that, you know, when it's over that their provider is ready to prescribe yet. So sometimes it's truly just an educational, we want to feel this out and really learn more about it.
So if they're not a current CNCA patient, do they need to make an appointment with one of the physicians and go that route first before they can be introduced to the Wednesday clinic?
Yes, currently that's the way we are set up. So if you can call in and you tell them that that is the reason you are looking to come, then they will make sure that you at least get your first appointment with someone who is registered to the CURT registry.
Awesome. Thank you guys so much for your time today on behalf of the Texas Autism Society and Compassionate Cultivation. We could not have asked for a better panel, and this information was great. Did you have anything you wanted to say?
No, thank you all. This was great.
Thanks all for joining us.
Yeah.
Thank you for joining us.
Bye-bye.
Thanks.